Good morning, everyone. Welcome to the annual symposium of the Center for the Precision Mental Health and Wellness. I'm Leanne Williams, the director of the center, and I'm delighted to see you all here today. We'll be starting our official program in several minutes, and I will run through a few highlights of the center and programming notes ahead of that time. I founded the Stanford Center for Precision Mental Health and Wellness in 2018, and it's my absolute pleasure to welcome you to our fourth annual symposium for the center. Today's symposium is co-hosted by my center and by the major labs and clinical translational incubator in our Department of Psychiatry and Behavioral Sciences at Stanford. Someone's saying to increase the volume. Thank you, Kyle. And that incubator is led by Karen Parker and Vinod Menon. Today, we're excited to offer CME credits for the program. If you'd like to learn more about CME, please visit the registration desk, which is out the front. The learning objective for today is to learn about at least one major accomplishment in predicting treatment outcome in depression. Today's presentations are being recorded, and the recordings will be available later through the center website. Please tag our event, share widely on social media, and you'll see the different links here on the slide behind me. So you'll see for X, known as formerly as Twitter, Instagram, and you'll see the YouTube channel for where we host previous symposia recording as well. This year's symposium theme, From Data to Care, Precision Medicine in Action for Mental Health, reflects the significant momentum building in the field. In 2024, we are seeing the true arrival of precision mental health. A recent study in Lancet Psychiatry predicted that 1 in 2 people globally would develop a mental health disorder in their lifetime. And we were just talking about it earlier with our opening plenary speaker about how significant is the crisis in mental health. At this inflection point, with this growing mental health crisis, we also have more data, technology, and treatment options than ever before. We have a unique opportunity to advance precision mental health and make a meaningful difference. Our center's work offers solutions to the question of why would we expect a one-size-fits-all approach to mental health to work for everyone? We believe true precision means understanding the whole system affecting each person, including their life experience, their current situations, their biology, and their future challenges. This year, we demonstrated that across studies, we can use brain scans to identify specific types of depression and to personalize treatments. Our discoveries, along with other exciting discoveries, are highlighted in Stanford Magazine's special issue on psychiatry's New Frontiers, and you'll find a copy on your table. Precision mental health is being driven by the power of increasingly large data sets. These data allow us to uncover the unique signatures of individual mental health experiences and understand the factors shaping outcomes on a population level. The use of computational and AI tools is a cross-cutting theme in our research. We have established a platform for standardized assessments for clinical, cognitive behavioral, and brain imaging modalities. Many of our center members use at least one of these modalities in their projects. For example, the standardized fMRI imaging platform is used in novel studies by Tricia Suppies and Carolyn Rodriguez, investigating rapid-acting exploratory therapeutics. He's also used in the catalyzing work of Chen and Bao, developing wearable sensors. And the cognitive assessments are used in both adult and child research, including research on ADHD led by John Lyckoff. Because these platforms are standardized, we can now integrate the data into a center repository. It's called Stanford BrainNet. It will contain data for about 7,000 individuals. And a unique feature will be the rich depth of the data, cutting across those modalities, and also the number of clinical participants with particular conditions of mental health. Over the coming year, we'll be planning a system for managing these data so we can ultimately make them available to you and to our wider research community. We believe that now is the time to translate discoveries into real-world impact, both in clinical settings and in people's lives. To bridge the gap between discovery and real-world impact, our center is deeply committed to fostering collaborations with a wide range of clinics and programs. We're excited to highlight the establishment of a first-of-its-kind clinic, the Stanford Translational Precision Mental Health Clinic, led by Dr. Laura Hack, who will be with us today, and by Dr. Teddy Akiki. More about the clinic will also be on the slides that you'll see during the breaks. We are urgently focused on developing actionable tests for mental health, and today you will see compelling examples of these new directions in our field. I hope you will leave with a sense of optimism and an understanding and appreciation of how advances can transform the lives of many for the better. Let me now turn to some important notes of recognition. My co-director, Ruth O'Hara, she will be hosting with me the panel discussion at 2 p.m. As many of you know, she embodies a fearless leader. She steps out boldly for the betterment of the common good. She sees clearly and she focuses on positive actions, and that empowers many teams and our community. Our speakers, I'm incredibly grateful to our plenary and keynote speakers for bringing us such an exciting program today. I also thank the presenters who will share their discoveries in our poster and happy hour session at 3:30 p.m. We will be awarding a prize to the top 3 posters, and I'm already aware it will be a very tough competition. The planning committee, you will see members of the planning committee on this slide, and I express my huge appreciation to each of them. They've done so much behind the scenes to bring you this event today. A special thanks to Hosna Omazad, the executive director of our center, who has gone above and beyond and truly worked miracles to bring us this event today. If you're interested in learning more about the center and its programs during the day, look for 3 people. I'll ask them to raise their hand. So Hosna Omazad, you've just met. Dr. Lara Folland-Ross, our senior academic research scientist for neuroimaging and precision mental health. Dr. Shui Zhang, she might be at the registration desk, our postdoc fellow. And a thanks to all members of my lab who've been vital to the planning. You will see them throughout the day. They will have a tag that says PMHW. They'll be at the registration table, and they'll also be playing the chimes to keep us on time. I'd like to thank the Li Ka-Xing audiovisual and facilities team. Thank you to Kyle and to Jen. We really appreciate your support. I want to extend my heartfelt thanks to all of our center's supporters. They've been partnering with us to bring the vision of precision mental health to life. Several of our supporters will be here today, and I'm proudly and profoundly grateful for your invaluable support. Your generosity has enabled us to take bold steps in developing new technologies and new treatments that might not otherwise receive traditional funding. Your support has also enabled us to nurture young scientists who represent the future of the field. Your contributions help us explore uncharted areas, accelerate breakthroughs, and deliver personalized care to those who need it most. I also express my gratitude to our development leadership in creating opportunities for supporting the center. Lyra Ghosh, Jack Fissinger, standing at the back, and Emily Simonson are here with us today, and please see their contact details on this slide. One of the new initiatives in the past couple of years in our center has been the establishment of the Precision Mental Health Corporate Members Program. This program is an opportunity for industry thought leaders to attend this event, present at this event, and to engage with us in facilitated discussions. My special thanks to Dr. Nir Eshel, a faculty director for this program. He's here today, and please reach out to him to learn more about the program. I also want to recognize all members of our center who are doing such important work, spanning many areas of precision mental health, including neuroimaging modalities, computational approaches, digital technologies, and novel therapeutics, to name just a few. Our center also spans across the Stanford campus, all of its schools, and the VA, and all of those schools and VA are represented today. I invite you to learn more. There are links here, and that sheet is also on your table. You will see highlights to the amazing research of our members throughout the day on the slides, and then you will learn more through the poster session as well. I invite you to become a member of our center if you aren't already. The sign-up information is on our website and on the printouts located at each table. I also encourage you to check out the center's resources, and the links will be on the slide behind you. And those include past symposia, seminar presentations. These are on our YouTube channel, and the recording from today will also be posted there. Now let me turn to a few notes and house rules for the symposium. Importantly, program and food. We've designed the program to encourage interaction between attendees and presenters. And so that means in between the scientific presentations, there'll be a full lunch break, as well as morning and afternoon breaks with coffee, tea, and chat. For questions, all speakers encourage your questions and discussion. To ask a question, look for the microphones. I'm not seeing them right now, but they will be there. And we will have a roving mic. If you think of a question later and it hasn't come up in the Q&A, please email it and we'll share it with our speakers. So you can use the email address at the bottom right there. There'll be a short Q&A after each presentation. Then at 2 p.m., we will have a panel session where there'll be an extended Q&A and discussion session. And all the speakers will join us for that. I appreciate that they'll be here to join us. And we'll have a special guest, Michelle Mongi, who will join us. Then at 3:30 p.m., after the panel and a short break, we will invite you to our poster session. And this will be held in the room adjacent to us. So you can go out and turn right and be in the poster session. That will be combined with an extended happy hour and another chance for interaction. As I mentioned before, we will award prizes to the top 3 posters. We also invite you to participate in our research or to share the research with others who might want to participate. And there'll be links, QR codes to the different studies offered by the members that will be up during the breaks. For restroom breaks, you will find the restrooms outside, so to the right and to the right again. And please let any of our staff know if you have other questions about the facilities. So tag us on social media, share widely, highlight our speakers and the wonderful presentations that they'll be giving, and keep your questions in mind for when we get to the Q&A. So I think now we'll have a short break. We'll have a 5-minute break, and then we'll look forward to commencing our program. So I will see you again in a moment.